Now, as we look back on 10 years under the 2010 Constitution, we take stock of how the quality of life of most Kenyans has changed. Article 43 was one of the commitments in the Bill of Rights that would directly impact the everyday lives of Kenyans, from how and where they lived, the quality of health or schools they would go to, and even the water they drank. So, did we implement the social and economic rights spelt out in Chapter 4 of the Constitution? Or did they just remain words of hope in our country's supreme law? Take a look. This place has represented pivotal moments in our country's history. It was here at Uhuru Park where the 2010 Constitution of Kenya was lifted in front of a multitude of citizens. That moment planted a seed of optimism that things would be different this time because it was a law for the people, by the people. Now, one part of that law that was meant to transform the everyday lives of Kenyans is Article 43 that we rarely talk about. Things like access to adequate housing, access to health, clean and safe water, and education not only were obligations of the state to deliver to citizens, but rights. And this was unprecedented because it was the first time that such rights were included in the Constitution of Kenya. Now, 10 years on, where are we? Has the quality of life of most Kenyans improved? Or is it a case of a dream deferred? In Nairobi's Kibra slums, just like in many other low-income neighborhoods, the prospect of a new constitution with a promise for better housing and other social benefits was alluring as the country headed to a referendum in 2010. Mzee Maina, who has lived in Kibra since 1982, was also hopeful that for the first time he would have a dignified house to call home. But 10 years later, he is still waiting. He had pinned his hope on the Kenya Slum Upgrading Program, an initiative conceived well before the 2010 Constitution, but one that began bearing fruit after its promulgation.
Tuna imani itafika. Na tena wakati tulikuwa na 05 especially, kila mtu alikuwa anaandika watu wake wote wale wamekaa na yeye. Si hata saa hii hakujakosa watu wamekufa, na bado tunawashughulikia wale ambao walikuwa wameandikwa kama wakaaji wa hiyo nyumba fulani. Nyumba ingine ilikuwa na watu 6, wote wameandikwa kwa hiyo data. Tukienda hapo tunaona kweli wewe ulikuwa mtoto ya ule Kazugura wa zamani.
Maggie too lives here in Kibra. This is where she was born and raised.
So nikiwa mdogo nimezaliwa kwa nyumba ya matope, ilikuwa single room, niko na mabro wawili, niko na big bro, niko na bro mdogo wangu, niko na cousins. So for me nikiwa mdogo life nilikuwa naona tu iko normal. As long as naona mom, dad hapo, nitoka nje nicheze na marafiki zangu. Kwangu nilikuwa naona tu ikiwa normal sasa. Sasa tumeishi kwa hiyo nyumba, like sikuwa na mentality yet naweza ishi in a better place. So grow, nimefika around class 4-5. Nimeanza kuambia ukisoma vizuri unaweza pata gari, unaweza enda kuwa mtu mkubwa. So nimeanza kutamani hizo vitu. Niko like, we, siku moja manze nitakuja, nitasoma vizuri, nitamaliza shule, nitajengea mamangu nyumba ya mawe.
A stone house in Maggie's mind was adequate housing, and for her, this is a promise the Constitution made and has delivered. Maggie and her family were enumerated back in 2005 as the first batch of Kibera residents known as Zone A who would move into the now constructed Canaan estate. That happened 12 years later in 2017. Maggie is grateful, but she says the wait has been much too long.
Ile time yenye tumefanywa enumeration to 5, it was like, what, this whole place itajengwa at once, waiting for a few months or probably 1 year, few months to come. And then it's been years, people are still struggling. The point is, what is it really happening? Where is the problem? Because they're still having water shortage, they're still having difficulties living in the community. The community is still dirty, health has been a problem.
According to the 2019 census, some 185,000 people live in Kibra, but many other estimates put that number at anything between 250,000 to 1 million people. Here, up to 8 people can call one of these 12 by 12-foot makeshift structures home. Sanitation is still a problem, with a toilet block serving approximately 50 households. Water prices here are astronomical, with a Kibra resident paying as much as 10 shillings for a 20-litre jerry can, compared to a resident in a Nairobi suburb paying between 34 and 53 shillings per 1,000 litres. The trickle-down from the constitutional promise is yet to be felt by a vast majority of these residents.
So that's what we have to reflect.
Bobby Mkangi and other constitutional drafters hoped the implementation of the ideals in the Supreme Law would improve Kenyans' livelihoods.
Because at the end of the day, Mwananchi will always judge his or her life according to how they feel in the pocket, regardless of the concepts, the technical issues, how beautiful the design of the Constitution is. If Mwananchi doesn't feel it in his or her pocket, it's a useless game. Yeah.
However, the 2020 Comprehensive Poverty Report by the Kenya National Bureau of Statistics paints a different picture. It indicates that 15.9 million out of 44.2 million Kenyans are poor. This translates to an adult earning less than 3,252 shillings in rural areas and 5,995 shillings monthly in urban areas. And the effects of the ongoing COVID-19 pandemic have further exacerbated an already fragile socioeconomic environment. And many hard-working Kenyans are yet to feel the relief that they hoped would come with the promulgation of the 2010 Constitution.
Section 43. Hakika haijaweza kuzingatiwa ipasavyo.
Watu wanabomolewa nyumba zao.
Kwamba wengi wanaishi katika slums na katika shacks.
Mambo ya chakula kwa wananchi ya Kenya wenzangu ni kwamba haijatekelezwa vizuri sana.
Serikali kuu imebaki na fedha mingi sana ambazo zilitakiwana ziweze kuletwa kwa serikali za katuzi ili hii kipengele cha afya kiweze kutekelezwa vizuri.
It is not all doom and gloom, however. The Constitution has brought some good, and the residents can attest to the changes in some services in the last 10 years.
There was a lady who was just cleaning up and then a dog came, it bit the lady. If it was before, probably tungetafuta fare, tuchukue gari, tumpeleke hospitali. But today, a CHV came, wrote a referral letter. They came together, they took the lady to the hospital, and I think that is a good impact.
Kenya's healthcare system, though, has been tested during this pandemic. Article 43 calls for access to the highest attainable standard of health. Since 2013, health has been a devolved function. The idea was to improve efficiency of service delivery as well as promote accountability and transparency.
Health is largely a devolved function, but county governments are no longer treated with the importance of functions that they have. County governments have to beg the national government for resources.
Defining programs like the Linda Mama initiative that saw the provision of free maternity health care and reduction of maternal and child mortality rates have been marred by others that didn't quite get off the ground. For instance, the 800 million shilling mobile container clinics that are yet to be staffed, furnished, and distributed to the counties. Not to mention the Managed Equipment Services program that was to provide counties with equipment for dialysis, emergency, maternal child health, basic and advanced surgery, critical care, and imaging services.
All of the procurement for counties was never left to counties. Was left to the national level, which procured without a needs assessment from the counties.
Challenges overshadowed the project that saw some equipment lie idle in hospitals and in some cases no equipment delivered at all.
You can have a hospital, but does it deliver health and medical services? Because that is what the Constitution and what Kenyans want. Kenyans do not want, and that's why the law does not say the government shall hospitals, water taps, those are infrastructural. They are ways and means. What Kenyans want are the services.
What is the place value of Digit 1?
Over the last few months, another service that has been disrupted is education, as schools have been closed since mid-March.
We have weakened our education, our public education, public health system, and now we have been shown, unless we invest in those, the little things that we take pride in do not count.
Since 2003, Kenya has boasted impressive primary school enrollment rates that now stand at 91.1%. However, with the increased number of pupils came the need for more classrooms. The Kenyan government has taken steps to expand existing infrastructure and build new schools, but this hasn't had much impact. Between 2012 and 2016, the number of public primary schools grew by just 13% to 22,945. By comparison, private schools grew by 64.5%. Huge disparities exist between counties as well in the rural and urban areas. Turkana has on average 92 learners per teacher, while Mandera has 80 and Garissa 67. In contrast, counties like Nyeri, Machakos and Nairobi have 25, 32 and 40 respectively. If these disparities persist, experts fear we will continue to see unequal development, which could have dire consequences.
But if there's something that will finally get Kenyans to the breaking point, is the non-implementation of economic and social rights.
So I think the best way of improving this is to ensure that there is social accountability, that Mwananchi himself and herself plays a central role in holding government accountable. But that begins with Mwananchi knowing, being sensitized and knowing their rights and their roles in governance.
Victoria Rubadiri, Citizen TV.